hand over the moderation to Professor Tian.
Thank you. Thank you. And we will move now to our second speaker, Professor Swaran Singh. Professor Swaran Singh, Commissioner Equality.
No?
What? Second speaker? Okay. He is on your list, the third one. So, sorry, we will move to Mark Hermans, who comes from Belgium, child and adolescent psychiatrist, working in two settings, in Mechelen and Sint-Niklaas. His main interests go to the treatment of youngsters between 10 and 18 years old. And the topic of his lecture today is Perspective from UEMS section for child and adolescent psychiatry, the section for psychiatry. Please.
Thank you for the introduction. If you see me disappearing during my lecture, that's not because I'm fainting, just because to have a short drink. I hope that my voice will hold up until the end, because I'm a little bit suffering from a cold. Thank you very much for the invitation and giving me the opportunity to present on UAMS, both sections of adult psychiatry and child and adolescent psychiatry as well. Mille grazie, professore. Mille grazie. So, this is the structure of my talk. I will introduce you to UAMS, then I give some introduction to the UAMS sections, work and output, the training requirements for psychiatry in general, and the transition psychiatry as we address it now. So first of all, the UAMS. These are the main focuses of UAMS. It's about postgraduate training, continuing medical education and professional development, and quality assurance in practice. And all of this within the framework of the EU harmonization as the main paradigm. So what about the legal aspects? UAMS is a not-for-profit association, and it represents 1.6 million medical specialists all over the European Union. It has been established according to the Belgian law, and according to that law, you need a General Assembly and Executive Bureau. So the executive now has a Polish president, Dr. Romuald Krajewski, who is a neurosurgeon. We have Edwin Bormann, an anesthetist, Giorgio Becchici as an Italian present as a treasurer, and Slatko Fras, who is a Slovenian colleague, who is the liaison officer. So our General Assembly, our council, contains 34 national general medical associations. And each of these general medical associations is allowed to send to the council 2 delegates, but they only have 1 vote. There are, at this moment, 28 EU states, and next to that, we have associated countries and also observer countries. And associated countries such as Turkey, such as Israel, an observing country nowadays is Morocco. So this is the internal structure, the legal structure. You have the general medical associations, and they are sending their delegates to the council. But next to that, we have operational structures, because a legal structure alone is not sufficient to run an association, as you might know. So each general medical association can appoint a country-specific specialty association, and these are sending 2 delegates to the sections and boards. So this becomes rather complicated with this as a result for an internal structure. So we do represent more than 50 medical specialties recognized in Europe. And all these specialties are represented within the different bodies, operational platforms within UEMS. The major ones are the sections, and we have 39 for each specialty, just because you need more countries where one specialty is recognized before you can establish a section. And each of these sections has a European board. This European board is conceived as a permanent working group within a section that will set specialty-specific standards for education and training. So these, again, are the main focuses of UEMS. We have also European operational bodies, and one of the most important within the UN